Hello, everyone, and welcome to this audio podcast. This audio podcast, as part of a Phantom edition, this audio podcast as part of a Vertex Roulet, this audio podcast as part of a Bostix Machina, this audio podcast as part of a Cyclone bonus, and this audio podcast as part of a Storm Robotics production. In this audio podcast, I look at a research poster presentation that had been developed that had been co-developed in around 2022, and where the research poster presentation formed part of the sort of awareness in around the awareness, if you like, of looking at educational support surrounding chronic kidney disease, and looking at this works from a qualitative perspective. The original sort of collaborative works had been peer reviewed and published, but have been published in sort of in more in sort of more recent times, in around 2023. However, this research poster presentation was pu- was a poster presentation that was again co-developed between varying academic institutions, institutions, to social media platforms, and also and also and also to 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 NHS trusts to NHS trusts within the southwest, in the United Kingdom. And also, where one collaborator was where there was a collaborator in this works, as part of this works, where the collaborator was from within an organization in the United States. So, and looking at the aims of this works. So the aims and objectives of this works, in this works, was to include look to include the following to understand how healthcare and education for chronic kidney disease, around chronic kidney disease, and patients encourage patients encouraged to take a lead in aspects of healthcare. The objectives of the research include one, to describe how CKD patients are managed in between healthcare sectors, with a view to capture and analyze qualitative data from the perspective of patients and healthcare professionals. And two, to understand options for obtaining advice and educational support through online platforms. This primarily UK investigation sought to understand educational support surrounding chronic kidney disease, or CKD, and investigate patient and allied healthcare professional perspectives. In regard to the background, so as part of the background, so whilst CKD is not a terminal condition, more common is a slow decline in general health, and sort of and where there can be metabolic and biochemical sort of disturbances, disturbances. Recipients are living longer, and more awareness and local solutions through community and through social media platforms can help inform and deliver health improvements for CKD recipients. In in sorry, for improvements for CKD recipients, or in those recipients who have not developed, who have yet, for example, not developed. Sorry, for those recipients who have not yet developed end-stage renal disease, or ESRD. The inclusion of healthcare service users is and has been increasing, but it has not been evaluated or contextualized regarding CKD, and educational provision through social media educational provision through social media platforms. So, in regard to the role of education, so there is evidence to suggest that more healthcare promotion in the community and community can support some of the educational complexities relating or regarding to health and disease. In investigations, a mixed methodology and triangulated research works, three academic institutions, two health departments, and two indigenous organizations collaborated to identify workforce capacity in remote communities through innovative education. A need was found to educate educators in regard to chronic care, around chronic care model, and in using a population health approach. The training needs analysis identified very little difference between education and training needs across rural and remote health disciplines. It was perceived educators managed chronic disease well, yet found prevention and early detection to be at the sort of hard end. Collaborative, patient-centric education should prompt or promote the active participation of each discipline in patient care. Collaborative working enhances patient and centric values, and provides mechanisms for continuous communication amongst caregivers, and optimizes staff participation in clinical decision making within and across specialties, and also fosters compassion for inclusion when there is contribution from all healthcare professionals. There is now an increasing, a body of investigational research that focus on linking, for example, education, literacy, peer support, and peer support. Therefore, it is now more transparent that integration of point of care is becoming or has become more important in patients with long-standing conditions, where especially where healthcare has become remote. This, however, also presents an opportunity for allied health professionals (AHPs) to be involved in supporting of healthcare and education through digital medium, or the online space, and where the online space is also where patients or recipients seek out answers to important diagnostic questions. Health professionals in broader healthcare areas may have an impression of the reliability and helpfulness through interactions retrospectively. Most communication, for example, tends to be through letter, email, or through telephone, according to standard operating procedures. However, owing to co-developing research initiatives, recipients or patients and health professionals have opportunity to work together and inform healthcare decisions. This also potentially prompts a game change when working together wherein working together would help extend services and potentially outside the confines of healthcare settings. In regard to patient and public involvement, or PPI, so in part of this works was where the a research scientist investigator, or RSI, involved in the research plays the role of a facilitator, and not a healthcare scientist, thus adjusting the use of topic guide to effectively fit the participants involved. At times, this required the RSI to also play a slightly more active role, providing a background of research to potential participants to fulfill inclusion and exclusion criteria, and to help inform the sequence of activities. The justification for using there was so part of this research, there was a justification for using a qualitative methodology design in methodology design to where attends which helps to tend help helps and tends to answer tends to help answer multifaceted questions. Similar methodologies have also been utilized to help answer questions relating to works in around 2015 and 2020. Through co-development, the RSI organized two high street community workshops in the southwest of southwest UK, and PPI have been an important mechanism involving patients. Had led streamline focus and research rigor throughout this works. And as part of the investigation, 13 members in total, so 7 admin and moderators from the RPSG, and six from the kidney disease and renal support group, or KDARS for kids, attended 2 high street community workshops. Basic evaluation and feedback provided an understanding of recipients or patients' perspectives surrounding access to healthcare education to focus this research. The workshops were co-developed between patients, researchers, patients or recipients, researcher, and co-founders of 2 online social media platforms, the RPSG and KDARS, to move forward. Following the workshops, topic tagging activity was implemented between the two support platforms. In following workshops, the topic tagging activities were co-developed at a third renal workshop event collaboration with the RPSG and KDARS in around later in 2019, around October 2019, where topics between 2 global social media platforms were co-developed, having understood the aims and the remit in regard to around the RPSG and KDARS. Tags were co-developed against 14 different topics, having extensively investigated over a 1 month duration in regard to the most popular terminologies. Topics were tagged for 2 weeks per social media platform, i.e. 2 weeks through the RPSG online adult population for those suffering with kidney disease in the adult population, and 2 weeks through KDARS, where in young people, the online social media platform for young people and pediatrics suffering with forms of kidney disease. Topic tagging has been used in research or works sort of in regard to works by Murison 2000 in 2005 and Sivan and Pratt in 2007 and Zhong in around 2021. Now looking at sort of the ethics and interview guide. So general in regard to the ethics, general data protection regulation or GDPR in 2018 guidelines were implemented to ensure best practice surrounding confidentiality, data protection, and compliancy. All compulsory documentation had been approved. This research was appraised according to academic ethics committee and NHS ethics before starting any data collection and all other aspects of this investigation. The research was approved by a research ethics committee in the northwest part of the United Kingdom. In regard to now the interview guides, so topic guides were used or utilized to provide a basic content on the structure of semi-structured qualitative interviews. Scheduled telephone interviews were conducted to ensure data generated was high quality and participants had positive interview experiences. Guidance was sought from several texts to gain understanding of process and flow. Works in regard to process and flow during and following in during and following sorry yes and to ensure academic rigor and during and following interviews during and following interviews and so additionally guidance was sought from supervisory team supervisory team or amongst the supervisory team. Telephone interviews were conducted in a private setting, and the RSI informed participants that interview was being recording and highlighted formality of interview process in according and to help reduce interview bias, participants were informed that it would be important to provide and highlight views in regard to long-standing condition, long-term condition, and according to literature and broader healthcare. And it had been hoped that the research would reflect perspectives. The topic guides instrument included a closing discussion which reflected on themes, points raised during interviews, and provided an opening for participants to reflect on the interview on interview content. Participants were provided RSI and research team contact information and were informed they would receive a summary following the research. In regard to the participant identification, so the local clinical research network helped identify general practitioners and or nurse and or general practitioners in amongst the southwest. The Royal College for Physicians also helped identify general practitioners. The Institute of Biomedical Sciences helped identify biomedical scientists with for example clinical biochemistry backgrounds. The Association for Clinical Biochemistry helped identify clinical and consultant scientists, and the NHS NHS trust in the southwest one of the NHS trusts in the Southwest, helped identify renal clinicians and chief administrators for the RPSG. The social media platform helped identify CKD patients, and specifically CKD patients, recipients stages CKD 3 through 5 for a single telephone interview. In regard to the participant approach, before recruiting, the RSI approached potential participants to identify if they were suitable to be involved in the investigation through face-to-face and or telephone communication. Contact details for participants were made available for participants to approach the RSI, and so that they can retrieve more information about the research before making a formal decision of getting involved. The RSI sought to seek consent. The RSA sought to seek consent after providing a basis in regard to the investigation. In regard to now, looking at the participant recruitment. So before recruiting, the RSI sought to establish whether potential participant is suitable to be involved in the investigation. And at the same time, a potential participant had the opportunity to ask questions about the investigation. The RSI also informed participants that the work would be used for research purposes only, and research introductory flyer, information sheet, topic guides, and consent forms were made available before recruitment. There was no at the same time there was no randomization process in recruiting participants. However, quota sampling allowed the RSI to ensure there is equal or proportionate representation of participants depending on age, ethnicity, gender, and educational background. This process also prevented a selection bias. A dedicated advertising section of the RPSG website was organized by the RPSG team once ethics application had been granted through the academic or university ethics committee and the NHS ethics to recruit potential CKD recipients and healthcare professionals. The web page allowed displayed research flyers, participant information sheets, topic guides, and consent forms. The RPSG website and appropriate URL was made available to complete online. Now looking at sort of the justification for theoretical framework and in regard to inductive analysis approach. So inductive content analysis, or ICA, as a research method or methodology is a systematic and objective means of describing and quantifying a phenomena. ICA is also known as the methodology of analyzing documents. ICA allows an investigator to test theoretical issues to enhance understanding of data. Through ICA, it is possible to distill words into fewer content-related categories. It is assumed that when classified into categories, words and phrases, ICA data creates or helps create meaning. Having become acquainted with transcript data using particular software allowed generating initial codes for ICA. The software provided opportunity to classify and sort and arrange a transcript context, and thus allowing to analyze data, glean insight, and overall develop conclusions. Using the software using a using an aspect of coding of a coding density of coding using an aspect of coding density through the software was particularly helpful because this supported a tracking of analysis for ICA. Semi-structured topic guides were developed to help prompt data collection across participant cohorts. Now looking at some of the data that had been that had that some of sorry some of the analysis or the results that had been shared that had come through from healthcare professionals and CKD recipients, and where the analysis of the results linked to particular themes, linked to particular themes as part of this works. So, in regard to healthcare professionals, for example, in regard to understanding of CKD and perception of kidney healthcare. So, where in regard to understanding of CKD and perception of kidney healthcare, and where context is from the context that will be described is from general practitioners from general practitioners or primary care physicians. Okay. There are many people who are also there are many people who would not understand, despite leaflets, what the hell CKD is and what is good for them. Wider healthcare professionals who have expertise and where patients can visit or contact would be more proactive. Relating CKD to a GP's code, GPs code it according to what has been conveyed by healthcare scientists in the laboratory, but because it does not have a physical impact on patient, it only gets described as a problem in patient notes and not much else. And in regard to the context, so what was just highlighted or alluded was in regards to the actual context from a healthcare professional in amongst primary care. And now looking at sort of the context in regard to the evidence where literature is concerned. So there are significant numbers of patients who do not want to understand what CKD is and what lifestyle changes are required. There are many people also who would not understand, for example, around despite leaflets and what is good for them. So in context around this, the GP or the primary care physician here suggests, as others, that it might benefit to CKD patients that they have access to healthcare professionals with specialist knowledge to help understand different disease stages and at what point treatment needs to be escalated. And as works by Jones and team in 2019 and works by Koch and team sort of retrospectively in around the early 2000s, and works by Armstrong and team in around 2009. Now looking at another theme in regard to primary care or general practitioners, looking at the theme around education in healthcare surrounding long-term conditions. So the context, the context is it's how bothered patients are and how much information do patients want. How much information do patients want? Having pre-printed information, I mean there's certain things there's certain things, information leaflets from different societies would be helpful to have similar for CKD patients. NHS does not make collaboration easy. Community education from an MDT or multidisciplinary team, not just CKD but other LTCs or long-term conditions as well. Um, in regard to the evidence around this, so one GP or the general practitioner perceives that the level of patient or healthcare service user interplay in main terms of in terms of how much information they want. It could be suggested that the level of interplay relates to many complex broader factors connected with individual circumstance, demographic factors, health literacy, family, and history. A second GP, a second general practitioner informs in regard to the needs of patients to be provided with information and need for in regard to broader education. And there's works by Stevens and team in around 2007, and works by Park and team in 2019, and works are also sort of more retrospectively by Go and team in 2004. Looking at sort of another theme in regard to healthcare professionals and general practitioners, as sort of a third theme in regard to safety and governance. So in regard to the context, if patients know that there is if general practitioners know there is a patient who has got CKD or is at risk of developing CKD, or in medicine which increases the risk of developing renal insufficiency, they will play safe. It really is about patient safety. And in regard to the context, in regard to the context, in regards to the evidence, the evidence. So the general practitioner relates understanding, or regards understanding regards understanding the patient safety and medication and pharmacotherapy management, and there is a need to be aware of recipients who may be who could be at risk, or could be at risk or suspect or at risk of developing CKD due to pharmacotherapy. Due to sort of pharmacotherapies, diagnosis and coding are important, and there is amongst where evidence is concerned, there's literal works that have been published from the Department of Health in around 2016, works by a chaplain and team in around 2020, and sort of again more retrospectively works by Go and team in 2004. Now looking at some of the analysis from allied health professionals and healthcare scientists. So in regard to the themes, looking at, for example, education through tech and digital healthcare. So the context, in regard to the context, health literacy is not always the problem. However, we're seeing more younger patients, and there is a desire for information and wanting to make sense of why things are being done and why they are and what they mean. Signpost to patient.co.uk or NHS Choices and digital access to a range of health professionals could work quite well, especially only to provide additional education. Short video clips drilling down basic point of care testing or POCT and or information for CKD patients and the public would be helpful. Um, in regard to in regard to the literature and literature and in around the and around the in around the in around the in around so works from perspectives from allied health professionals and healthcare scientists. So as well as highlighting a need for easy accessible information on managing CKD available online or available and online. So one healthcare scientist interview felt that patients also need digital access to healthcare, digital access to a range of healthcare professionals. Another another felt Another felt that visual online education should be available to educate patients through POCT or point of care testing, and as works by Parker and team in 2019, and works sort of more works by Demulin and team in 2011, and sort of more retrospectively by works by Chaudhary and team in 2006. So now looking at perspective perspective from nephrologists or clinicians, and there were the themes and there were several themes, and in regard to the nephrologists and clinicians, looking at a particular theme in regard to health literacy and professionalism. So in regard to the context, now I suppose some people might argue that the information is given in such a raw form as to be complicated, as to be too complicated to understand for many patients, or that you might say that many patients might not have the ability to understand that information. So in regards to the in regards to the evidence, understanding informs the importance of acknowledging patient health literacy levels and a need to provide education that is accessible to all. And there is works by Ozaro and team from 2014, and sort of more retrospectively by works by Smith and team from 2006. Now looking at the analysis from the analysis or the results from the patients from CKD patients. So in regard to understanding of CKD and perception of kidney healthcare, the context, for example, was people do not know and are mistaken for other conditions. Fluid overload is a problem. It is because of the heart, again, because that needs to work. I've seen it for myself. A lot of people don't understand why. Mentioning renal failure is not a good idea because the patient might not be aware that they are looking for and but that because sorry mentioning renal failure is not a good idea because the patient might not be aware what they are looking for, and some patients will feel that there is a certain way they feel, and they will take it as a they will take it as the norm. In regards to in regards to the evidence, or in context of the evidence, the evidence and where literature is concerned in regard to this theme, understanding of CKD and perception of kidney healthcare. Patient informs 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 of in regard to CKD in regards to CKD and why fluid and in some bases why fluid retention occurs, and the patient talks about how healthcare professionals should communicate with patients around CKD, around chronic kidney disease or CKD, and how patients may not understand certain medical terminologies, and context highlights the importance and presence of condition. There's works by King and team in 2013, and works by Parker again in 2019, and works by Abel and team in 2020. Looking at the theme in regard to perception of healthcare professionals, perception of healthcare professionals. The context is where participants said had said, I don't think I should go to my GP for checkups. That's the reason I've got a consultant. But in my case, my GP or general practitioner is excellent, and again, it's another person I can just book an appointment with and say, actually, I'm a bit unsure about this, and I'm struggling a little bit with well-being, or I've got a little concern about my transplant, and the GP will talk to will the GP will talk to me about it. It just so happens that I've had the same GP since around 1995, and so she's got the understanding, and it's my big fear about where the participant informs that it's one of their big fears is in regards to moving away from the region I go to my GP. My GP, but is one of the reasons they go to the same general practitioner. Where the participants informs that GPs or general practitioners play an important role. So in regard to the context, in regard to the evidence and the context, it is important to understand comorbidities, including well-being, and where general practitioners should work together with patients. Literature informs patient perception, and need for specialist knowledge to manage CKD differs across regions. And there's works by Chaplin and team in 2020, and works by the Department of Health in around 2016. And looking at a sort of final theme, in regard to CKD patients. In regard to CKD patients, so influences on willingness to take ownership of healthcare. So in regard to the context, I think patient view has made a massive improvement, and a bit of an odd one, I think, social media. Now I hold those two are on equal level. I could not pick a favorite, so I'll tell you why. In terms of patient view, I can access my blood test, and I can do my blood test, and I do every time I do have a checkup. A couple days after my checkup, I go through my blood test and make sure I'm happy with everything. In regard to the literature and in context of the literature and the evidence, so it is important to have links between patient accessing. It is important to have have links between patient accessing investigations digitally and following medical appointments. Patient view, for example, is secondary care specific. Patient did not indicate, or a patient or healthcare service user did not indicate whether access to healthcare records should be between primary or secondary care or healthcare sector specific. By encouraging education across healthcare specialties or disciplines, this would reduce inequity, increase influence on taking ownership, and improve overall healthcare in a CKD population. And there is works by Howell in around 2010, and works by the UK RR or UK Renal Registry organization in around 2020. Now looking at some conclusions as part of this works. So after documenting interviews were critical in generating themes in preparation of inductive content and analysis implementation. This was achieved by conducting 19 telephone interviews between 4 cohorts. Interviews were conducted with a requirement to respond to the opportunities offered by each interviewee. There were some overlaps or relationships or associations relating qualitative data analysis between themes, and this was evident in both health professional and patient cohorts. Healthcare education, kidney care, and nomenclature is continuously advancing, and it must be appreciated that patients should be armed with appropriate context so they are able to have interactive communication and discussions with allied health professionals and broader healthcare service providers. There is scope for education service development and initiative focusing on allied health professional involvement, but there needs to be a coordinated effort between healthcare service interplay and healthcare service providers to understand where this can be where this can complement and improve chronic kidney disease CKD care and focus education provision aligned to a RPSG. So, for example, aligned to point of care education, or POC. Initial research follow-up has also prompted collaboration to the co-development of two initial CKD art book productions. So healthcare is deemed more integrated between primary and secondary care healthcare sectors. The art books, or the CKD art books, can support wherein healthcare service users, carers, and health professionals document healthcare according to themes. The themes and educational context with art prompt healthcare service user and providers to document in following and as part of discussions with healthcare with and amongst with and amongst and between healthcare service users and healthcare providers. And the art book production have also been co-developed, integrating collaborative efforts and perspectives between the social media platforms and collaborators between academia and healthcare practices. Educational modules educational modules should be delivered between healthcare service users and healthcare and allied healthcare professionals, and this can be linked through for example, social media platforms or online organizations integrating CKD care pathways so that public health awareness and research meet practice excellence. That draws this audio podcast to a close. This audio podcast as part of a phantom edition. This audio podcast as part of a Vertex Roulet. This audio podcast as part of a Lobostics Machina. This audio podcast as part of a Cyclone bonus. and this audio podcast as part of a Storm Robotics production.